Good day everyone, and you are welcome to our last video on CHCAGE013, which is work effectively in an aged care setting. Today, please, if you're just joining, please try to review our past videos, particularly on this particular unit, so that you can be on the same page with us, and you can learn what we've discussed in the past. Today we are going to be starting with restrictive practice. Restrictive practice is an intervention that limits the movement of a person. Ideally, this is done as a last option, and only to ensure the safety of that particular person that is involved. The Aged Care Quality Principle 2014 lists 5 types of restrictive practice that we in aged care are likely to be seeing, or that we are likely to be using. 1. We have physical restraint. Physical restraint is, just as it's stated, is a way of preventing someone from moving from one side to the other. Chemical restraint involves the use of medication to be able to reduce the level of activities that a person is actually showing. For example, if someone is having like dementia now, and they are a bit aggressive towards themselves and others, and these are likely to cause harm either to themselves or others, there is a possibility of using some medication to try to calm them down. Other than using the chemical restraint, there is what we call the environmental restraint. That same person that you try to give medication to, you can put them or take them into the environment, or take them into the garden, whereby they can feel a little bit calm due to the overwhelm that they are witnessing in that environment, in the previous environment. Maybe there's a lot of clients or a lot of staff and other people there, so this might be a little bit overwhelming for them, and putting them in a different environment can help them to relax or even calm down. Other than that, we have what they call mechanical restraint. This is using some mechanical aids to restrict or to remove or even reduce the level at which someone is moving. Example of this can be using of lap belt, or using of some harness that will keep someone at a particular seat or even at a particular station for a particular time. There should be a time lag associated with this particular instrument that we're using. And the last one is seclusion. Seclusion usually is done for people with mental health, and if someone is very, very aggressive to themselves and others, we tend to put them in a secluded area. And if someone is in a secluded area, there should be a plan for appropriate monitoring of them, and there should be a record showing that they are safe at all times while they are in this seclusion. If we can't do this, then there is no way we are going to be going forward in putting this in place. So restrictive practice can only be used when you've tried all other means to prevent harm. 2. When you have considered all the risk and effect of this particular practice. 3. When the person or their advocate have given their consent that you can go ahead and use it, unless in situation of absolute emergency. 4. When it is in the best interest of that particular person, you can use restrictive practice. 5. When there is an expert present who can ensure the person's safety. There may be emergency case where you cannot get a person's consent beforehand. In this situation, you must inform the person's representative why that particular practice has been done, that is, the restrictive practice has been done, and ask for advance consent for any future use of this particular practice. These are the expected steps and policy or procedure that is expected or that must be followed before we start or before you use any restrictive practice. And other than following all these steps, we should have a control measure as well in place that will show that we are trying to reduce any form of restrictive that our client or patient or other person in our care is going through. Recognize and report signs of abuse. Most of the time, this restrictive practice can be abused because sometimes we say, "Oh, Mr. B is wandering or is too aggressive." Instead of us sitting down with them and trying to redirect them, we just inform the nurse, and the next thing is to give Mr. B some medication that will calm them down. And this, of course, is an abuse. So abuse is treating someone with violence or cruelty. Someone in the position of power usually use this. Just as I said earlier, we as care workers sometimes we can exercise this power over clients that doesn't know that they don't know how to actually say their own mind about what is going on. So recognizing signs of abuse is a vital thing that is expected of us, and if we recognize this, we must immediately act. As an aged care worker, you must learn how abuse can be prevented in an older person, and if we learn and follow this, if there is anything that is expected of us, that might be a form of mandatory reporting. Mandatory reporting is to report suspected instance of abuse. Professionals who have the ability to do this include the teachers, the medical worker, the care worker like you and myself. This is to protect the older people from indicators of allegation of exploitation, abuse, harassment, or even neglect. The HK Act 1997 defined reportable incident as the occurrence or suspected occurrence of abuse, and this includes unreasonable force or use of unreasonable force, unlawful or inappropriate sexual conduct, psychological or emotional abuse, stealing done by aged care workers, to mention but few. If we identify this, it is our responsibility to report these signs. So you must follow or you must familiarize yourself with your organization policies and procedure on how to report any mandatory reporting. The following are other reportable instances. You personally witness abuse happening. A staff member or visitor tells you that they have witnessed abuse happening. Another person tells you that someone is trying to abuse them, or even individual organization will also have their own policies for reporting case of abuse. In any case, if an abuse happens, it is expected by law to be reported within 24 hours. And in line with the Record Principle 2014, a record principle states the record that care provider must keep. The required record include the following: record about care recipient, record about charter of aged care rights, and record about staff. All these records are expected to be kept, and those that doesn't have the right authority to access them must not should not have that information at their disposal. The next we're going to be talking about is maintaining workplace information. This means recording changes of yourself or other person in your care and adding them to the record. So it must be added as soon as possible to keep your record accurate and up to date. So to maintain the information, you can do the following depending on your job description or job role. Updating your information, updating the information of other people, and checking if the information is actually updated on ongoing process. While this information is being updated, of course, we should also have a look at how they are being stored and who is having access to those information. Unauthorized personnel should not have access to them. We should protect all this information from loss or unauthorized access. Monitoring own stress level when working with people. As I said earlier, if you don't love yourself, there's no way you can love anyone. So to work and to be effective in aged care, you need to look after yourself. It is very, very important to understand how your body works. So understand how you respond to stress. Check upon yourself if you start to notice something changes in your body that you think it has to do with stress. Attention, ask yourself if you are struggling to maintain your focus at work. Mood, ask yourself if you feel overwhelmed, pressure, or even anxious when you are at work. This will give you understanding of how to best support yourself. How can we do this? There should be a simple self-care strategy that, of course, depending on yourself, if it's working for you, share your feelings, talk to colleagues, and sharing feelings can help to feel better. And you can also talk to your family and friends in order for you to get any issues that you might be going through out of your mind. Take care of your health. Getting adequate sleep, eating on time is necessary to maintain energy in the workplace. So you must have the energy to assist other people with their daily activities. So it is very, very important that you look after yourself. So to identify if you need to start seeking support, you can ask yourself the following. Can I handle it on my own? If it is actually a stress, is it something I can do, or is it something that I'm capable of dealing with? Is my stress, is it has to do with trauma affecting my performance at work? Or is my stress, is trauma affecting the way I interact with others? Is my stress or trauma causing me to lose sleep or even to gain weight or lose weight? And am I daring going to work or seeing people in my care? So it's very, very important to be able to fear to yourself and answer all these questions fairly and appropriately. So know your organization procedure for informing your supervisor of what type of support you require is also important. If you are going through any form of stress, your supervisor can help you in many ways. So your organization might have a set up procedure. Try to familiarize yourself with it and engage your supervisor. Maybe during meeting, you both can decide on what action plan to look after you. Is it because of workload? Is it because of a particular client? Understanding this and mixing or moving things around can really support you. So follow your organization policies and procedure when asking for time off or receiving external support. So you must indicate the complete details of your request, which may include the date of the request time off, the purpose of the request time off, and additional evidence to support the request time off. Yeah, we need to be very okay before we can support in HK. And this will be the last slide. Thank you all for your time. And if you have any question, please send your question in. And till then, remain blessed. Bye for now.